Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education. Welcome to my channel. As you know, I make videos about health and healthcare topics, and today I'm going to discuss about steroids. All the information given in my videos are directly referenced from the internationally accepted US National Medical Library, so you can trust this information. So today we are going to discuss whether steroids are good or bad. Why do people say that taking steroid is bad? And if it is so, then why do doctors prescribe steroids? What are steroids? What is this fuss around? Is it good for bodybuilding? Is it good for protein, muscle mass, weight loss, weight gain? What exactly happens when you take steroids? Today we are going to discuss everything which you need to know about steroids. Guys, you may have heard about anabolic steroids, which can have harmful effects, that's true, but people use them for bodybuilding. But there is another type of steroid called corticosteroids, and these steroids are used to treat problems, medical problems. And these steroids are very similar to hormones which are produced inside your body by your adrenal gland, the gland which is just sitting above the kidneys, both kidneys. And these hormones, these corticosteroids, are made to fight the stress which is associated with illness and injuries. It also reduces the inflammation, but also affects the immune system. Right? So these medicines, these steroids are used. These steroids, corticosteroids, are produced by your body, by your adrenal gland, to fight the stress associated with illness and injuries. And they help you reduce the inflammation, the pain, the redness, the swelling, the injury, and they reduce your immune response towards the illnesses. That's why in autoimmune diseases, where your immunity is the sole reason for the problem, we use steroids. So steroids will be used for arthritis, asthma, lupus, multiple sclerosis, eczema, rashes. Steroids are also used in some type of cancers. So steroids are basically strong medicines, and they can have side effects, huge side effects. The most important thing, they can have long lasting side effects. There are certain medicines which can have side effects while you are taking them. When you stop the medicine, side effects goes away. But steroids can have years long of side effects even after you stop the medicine. So that's why we have to think about it, whether or not to give you that medicine. So we are going to discuss all these things about steroids today. So stay tuned, guys. We're going to start from the basics and explain you everything. Don't go anywhere. Let's start.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
So guys, your adrenal gland present above the kidneys produces a number of different hormones. We have to understand the basics here for even the purposes of future videos. So it's very important to concentrate. Adrenal gland has two parts, the cortex and medulla. Cortex is the upper part, medulla is the inner part. That's the basic. So outer part produces steroids. The actual steroids are produced by the outer parts, and these steroids are basically of three types. First is something called as aldosterone, which are the mineralocorticosteroids. These hormones, they actually control, regulate your salt and water balance. Salt and water balance, therefore they control your blood volume. Right? These aldosterone basically regulate the water reabsorption from the kidneys. The kidneys are basically filters, so they filter blood and form urine, a lot of urine. Much of that and urine has a lot of water. So that water is reabsorbed with the help of this aldosterone in the kidneys, and therefore you save a lot of water. And this is done by reabsorption of salt. wherever salt goes, water goes. That you have to, sodium basically. So sodium goes, minerals goes, water goes. So that's the basic here. So aldosterone, mineralocorticosteroids regulate your salt and water balance. Coming on to second hormone. Second is the main glucocorticosteroid, and that's cortisol. Cortisol is the main glucocorticosteroid. Glucocorticosteroid, as the name suggests, has something to do with glucose. Its basic function is whenever you have stress inside the body, your body tries to fill it up with supplies, and supplies is energy. Energy is glucose. So whenever you are energy deficient, whenever you have a problem, whenever you are in stress, these hormones are produced by your adrenal glands. Cortisol does a lot of things. It basically increases your blood sugar levels. How it does that? It increases the metabolism, mobilization of amino acids from your proteins. So proteins are used. It increases the synthesis of glucose from these proteins. So your own muscles are now used as energy. It also increases free fatty acids. It also increases some amount of fats. So it increases the free fatty acids in the blood so that these fatty acids can also be used to create glucose. So basic idea is to increase glucose in the blood by proteins, by using fats, by anything. So glucocorticosteroids basically do this. They have some other functions also apart from glucose. They basically suppress your immune system, because inflammation is the attack which your immune system does on the infecting organism, causing destruction in the local tissue, causing pain, causing swelling, causing irritation, causing fluid. So this hormone suppresses the immune system to actually calm down your guns, your own immune system, okay, to give you the required anti-inflammatory effect which your body needs after we have finished off the infection. So that's the second function, the anti-inflammatory effect. And that's why if there is a lot of steroids in your body, you can have more infections because your immunity is being suppressed, right? Then the third way steroids work is they reduce the capacity of your osteoblasts in the bones to produce new bones. It also decreases the absorption of calcium in the GI tract. So that's why taking steroids for a long time will lead to osteoporosis, bone problems. So corticosteroids is one of the most important medically used steroid which we give to patients of asthma, arthritis, allergic reactions, eczemas. Even the locally used steroid creams available in dermatology, in skin problems, have corticosteroids, glucocorticoids, to suppress the immunity, because basically these are immune reactions, these are allergic reactions. So second is corticosteroid. The third type of hormone produced by your adrenal cortex is sex hormones. Your adrenal cortex produces your testosterones and estrogens. In females, estrogens are more than testosterone. In males, testosterone is more than estrogen. And these hormones play a role in your reproductive system. And testosterone will give you male characteristics, muscular body, thick skin, beard, a lot of hairs, a lot of pimples, a lot of rage, thick muscles, broad shoulders, etc., etc. And female hormone will give you smooth skin, little more fat. They will give you a lot of female characteristics, gynecomastia, etc., etc. So these are the hormones of adrenal cortex. That's not all. Your adrenal gland also has a medulla, the inner part, which produces your catecholamines. And catecholamines are basically your stress hormones. The stress hormones, that means adrenaline, noradrenaline. That's what you've heard. I need an adrenaline rush, adrenaline kick. So adrenaline is basically produced by your adrenal gland and the medulla renal part, and it is produced in response to a stimulus, a fight or flight response hormones. So this adrenaline, noradrenaline, is a fight and flight response hormone. These hormones increase your heart rate, your blood pressure, your breathing. Everything is increased, your muscle contraction, blood supply to every single part of your body, every muscle increases, so that your performance increases, so that you can fight or you can flight away the danger. That's the purpose of these hormones. So these are all the hormones produced by your adrenal gland. Now, what will happen if there is an imbalance? And just like thyroid, there is a controlling mechanism in your brain from the pituitary gland which controls these hormone levels. So if one hormone is produced in excess, your brain senses the levels in the blood and suppresses that hormone production. When vice versa, if it is less, it increases that hormone production. So your brain control, pituitary gland controls it by ACTH. The normal function of your adrenal gland can be impaired by conditions such as infections, tumors, genetic disorders, autoimmune diseases, and side effects of medicines, medical therapies. The problem which can happen is that these hormones can become excess or deficient. And whenever this happens, you will have the related symptoms. So if you have corticosteroids in excess, you will have Cushing syndrome. So in Cushing syndrome, you will have a lot of sugar, a lot of sugar in the blood, so you'll have diabetes, and therefore you will also have obesity. You'll have increased blood pressure, excessive body hairs, obviously osteoporosis and depression. And most importantly, you will have stretch marks, a lot of stretch marks on the skin. Then, if you have excess aldosterone, then you will have aldosteronism. In this condition, there will be high blood pressure because more and more salt and water are retained by the body, so blood volume increases and you will have high blood pressure. So you will have electrolyte imbalance. Some electrolytes will become more, sodium will become more, potassium will be less. So aldosteronism. Then what will happen if you have a deficiency of these glucocorticosteroid, cortisol? Now, this happens usually if you take steroids for a long time and stop it suddenly, because there is a controlling mechanism in the brain. If you take steroids, your brain will tell your adrenals to stop producing steroids, and if you stop taking them from outside also, then you don't have steroids for some time in your body, and suddenly you're out of sugar. You have adrenal insufficiency. You'll have Addison's disease. So you will have less sugars in the blood. You will have fatigue. You will have a most important characteristic thing is you will have hyperpigmentation of the skin. You can go into adrenal crisis. You can go into hypovolemic shock. You can go into stupor. You can go into coma. That's why steroids should never be stopped suddenly. Then talking about testosterones, estrogen. If man has more estrogens, he might have gynecomastia. He might have less beard. He might have female characters. If a female has more testosterone, she will have more hairs, more pimples. She can have polycystic ovarian syndrome. She can have a lot of problems because of hormonal imbalance. So hormones play a key role in the homeostasis, in the maintenance system of your body. That's why hormonal levels should be checked. if you have any of these problems. And that's why doctors check for hormonal imbalance whenever we suspect that this can be the main reason. But then why do we give steroids? We do prescribe steroids. We prescribe corticosteroids, the main cortisol, the steroid. This medicine in prescription is given to treat chronic diseases, inflammatory diseases, to reduce the swelling, inflammation, and even sometimes the mucus production. And we use these steroids to even control the mucus production in the airway of the lungs, especially in asthma, right? So because that's life-saving, that's needed in that case, because the problem is your own immunity, your own immune reaction, your own inflammation. That's why in some cases steroids are useful, and they also help other quick relief medicines to work better. So these steroids are used to treat chronic lung diseases, and these are not anabolic steroids. Anabolic steroids and corticosteroids are different. Anabolic steroids, which are illegally used by athletes for bodybuilding, can have side effects on your liver or even cause sterility. But corticosteroids don't have these side effects, right? So these steroids are used in the form of nasal sprays, inhalers, sometimes injections, pills, and even lotions and creams for different conditions. So are they safe? Some of these corticosteroid drugs which we use usually to prescribe you include cortisone, hydrocortisone, and prednisolone. So these, as I said, are used to treat many conditions like rash, lupus, asthma, arthritis, etc., etc. All are autoimmune or inflammatory disease without any major infection, because you cannot give steroids on infection. If you give steroids on infection, you're decreasing your own fighting ability to the infection. Your infection can spread and cause sepsis. And that's why these drugs also carry a serious risk of side effects. That's why it's important to work with your doctor. And what are these side effects? As we already saw, these steroids can actually affect not just the local area where we want them to affect, either lungs or the arthritis. It can affect the whole body, and it can actually increase the pressure in your blood pressure inside the eyes, glaucoma. It can cause fluid retentions, causing swelling in the lower legs. It can cause problems with your mood, your memory. You can have behavioral or even psychological effects. You may have weight gain from some part of your body and weight loss from other parts of your body. So weight gain will be there more in your abdomen, face and back, and you will lose weight from your arms and legs and butts. So you might feel that you are losing weight, but slowly you are gaining also. When you are taking oral steroids for a long time, you can even experience cataract, where they have clouding of your eye lens, one or both. You can have high blood sugar, which can cause or worsen diabetes. Obviously, we are reducing inflammation and your immune systems. You have a risk of infections. You have thinning bones, osteoporosis, and easy fractures. You have suppressed adrenal gland hormone. And because you are taking corticosteroids, the production of steroids in your adrenal glands will be suppressed by the effect of your brain. Plus, you'll have skin thinning, easy bruising, slowered wound healing. You might have fungal infections in the mouth if you are inhaling these steroids, soreness of throat. Sometimes using steroids over the skin can even lead to red skin lesions or sometimes even acne. So what do you need to know if you are taking steroids or your doctor has prescribed you steroids? To get the most benefit of corticosteroid medicines with the least amount of risk, try to do these steps. Try lowering the dose slowly or intermittently, or take dose intermittently. There are some newer forms of corticosteroids which are coming in varying strengths and length of actions, so you can ask your doctor to lower the dose or use short-term medication. Ask your doctor whether you can take steroids every other day instead of daily. Or you can ask your doctor whether you can switch to inhaled steroids, especially for asthma, right? Because they reach the lung directly, so they can actually give a better result with less side effects. And you need to make healthy choices during therapy. When you are taking steroids for a long time, talk to your doctor about ways to minimize side effects. Eat a healthy diet, participate in activities which help you maintain a healthy weight to strengthen your bones and muscles. Take extra calcium. Most importantly, take care when you are stopping your therapy. Never stop steroid therapy suddenly. You have to slowly reduce the dose, give your adrenal gland time to produce internal steroids to recover his original function. So your doctor will also reduce the dosage gradually, and don't be over smart to take the same dosage and suddenly stop the medicine. That's dangerous for you. Reducing the dosage too quickly, you can experience fatigue, body aches, lightheadedness, all the symptoms of adrenal insufficiency. You can even wear a medical alert bracelet, where it's similar to an identification mark when somebody is already on a lot of steroids, and if we give them some medication, it can react. Steroids react to many medicines. So you need to know, and every doctor you go to, every emergency room you go to needs to know that you are taking steroids. And most importantly, get regular health checkups. If you are on long-term steroid therapy, you need regular health checkups to find out whether you're developing any side effects or not. So lastly, corticosteroids may cause a range of side effects, but they also relieve inflammation, pain, discomfort of many different diseases and conditions. So you have to work with your doctor to make the choices, make the right choice to minimize side effects and maximize your benefit and achieve the significant benefit with the reduced risk of such problems. So that's all about corticosteroids. Next time in the next session, I'm talking about anabolic steroids.